Hello, everybody. This is Dr. Koduru Manisha, junior resident from Dr. Shankar Rao Chavan Government Medical College, Vishnupuri, Nanded. So, today I'm going to present the topic on the echoes of precision, the role of ultrasound in diagnosis of benign renal and infectious pathologies. So, the aim and objectives of the study is the aim is to analyze the sonographic findings in patients presenting to the radiodiagnosis department with various clinical features like oliguria, dehydration, anemia, hypertension, nocturia, proteinuria, and study the diagnostic accuracy of ultrasound in detecting various renal pathologies. The objectives include the accurate identification, characterization, and monitoring of these patients. We need to accurately identify all the renal pathologies like cysts, angiomyolipoma, hydronephrosis, and must be able to differentiate from malignant or complex conditions. After the identification, we need to characterize them based on the size, shape, internal echoes, internal characteristics of these renal lesions, and being able to distinguish between the benign and malignant entities. Once we found out the diagnosis of the patient in fit him into appropriate renal pathology, we need to provide a reliable and non-invasive method for the follow-up and monitoring of these renal benign lesions over time so that we can prevent them turning into a malignancy. Now, coming to the introduction, there, these are the benign renal pathologies which encompass a spectrum of conditions such as the simple renal cyst, complex cysts, angiomyolipoma, hydronephrosis due to renal calculi, which are commonly encountered in the clinical practice. They require accurate diagnosis to prevent unnecessary interventions and assure appropriate follow up. The ultrasound now provides real time imaging and structural assessment of the kidneys and is considered valuable in this regard. Due to the improvement in the technology and the ultrasound settings, the Doppler imaging has been a boon to the radiologists because it is able to accurately diagnose renal vein thrombosis, renal artery stenosis, etc. Also, the ultrasound is of lower cost and there is no radiation exposure and very easily available, due to which is at the upper hand over the MDCT in diagnosing benign renal pathologies. So the advantages of ultrasound over the MDCT is it is non-invasive and safe, it is highly cost effective, and it is easily available bedside, and the proper visualization of the renal parenchyma and characterization of the renal pathology into simple or complex cysts or various calculi can be identified on ultrasound. The Doppler helps in evaluating the renal perfusion and also the vascularity, which helps in differentiating it from the benign lesion and malignant lesion. Because if it is a benign lesion, there will be no vascularity, and in malignant lesions, most commonly take increased vascularity. Now, what is a methodology is that is a descriptive observational study which was carried out in our department, Dr. SCGMC, from September to December 2024. It included all the male and female patients presenting to the department and all the unstable patients, hypotensive patients, and the patients who were ventilated, unstable, not able to move, and who were in shock were not included in the criteria. And a total of 100 patients were included in the study who underwent transabdominal ultrasound scan, and all the patients were compared with CT scan and clinically correlated. Now, these are a few of the cases which we'll be going through. Firstly, we will see the congenital anomalies of the kidneys. So, we are able to see that the 11-year-old boy presented with chief complaints of pain in the abdomen and decreased urine output. So, we are able to see that both the kidneys are towards the midline, which are labeled in blue arrows, and the lower ends of both the kidneys are fused. So, this is a horseshoe kidney which prevents the ascent of the inferior mesenteric artery. And next is the cross-fused renal ectopic. There is a 14-year-old girl who came with dripping of urine and burning micturition on and off since 15 days. So we are able to see that the left renal fossa was empty in this patient, and the left kidney migrated from the midline and has gone onto the right side and has fused with the lower pole of the right kidney. So this is a cross-fused renal ectopic. Next is a renal calculus. This is one of the most commonly encountered during our OPD times in the department. So here's a 35-year-old male patient who presented to the emergency with severe right lumbar pain. On ultrasound, we are able to see that the right kidney shows the mid-pole cortical calculus with no hydronephrosis. But on the left side, we are able to see that the kidney is enlarged and echogenic, and the pelvic calyceal system is dilated, that is presenting as mild hydronephrosis. And there's a mid-pole renal calculus. There's a mid-pole renal pelvis calculus which is noted. We are able to see the similar thing on the X-ray on the right, where the right kidney is showing the renal pelvis calculus. Next condition, here is a 33-year-old female patient who came with complaints of pain in bilateral lumbar region. So we are able to see that there are multiple tiny hyperechoic calculus which are present, and these tiny multiple calculus are causing upstream obstruction and also the dilatation of the collecting system. So because of this dilatation of the collecting system, we see the dilated renal calyces. And on ultrasound, these are showing posterior acoustic enhancement. The same thing on the CT scan of that patient showed a very large calculus which is present in the renal pelvis, and it's causing upstream dilatation of the renal pelvis and the calyces. And here is a 65-year-old male patient who came with complaints of sudden onset shortness of breath, decrease in urine output, and peripheral edema. The patient has a history of usage of anti-diabetic and antihypertensive drugs since 5 years. So we are able to see that the kidney is very echogenic and there is a thin strip of perinephric collection. The cortical thinning is noted. So if there is a raised echogenicity, probably it is a pre-renal AKI where it might be due to acute damage. If it is a chronic damage, there will be pre-existing chronic renal disease changes. And the corticomedullary differentiation is not maintained as in this case. Next is a chronic kidney disease. Here we are able to see that in these chronic kidney disease, the ultrasonographic findings include the reduced size of the kidneys due to renal parenchymal scarring and fibrosis, raised renal echogenicity due to fibrosis and scarring, and the cortex gets thinned out. The normal thickness being 1 centimeter, but here in these patients, the cortical thickness will be less than 1 centimeter, and the corticomedullary differentiation is completely lost. And we are able to see that the multiple small cysts will be noted and reduced renal perfusion can be noted on color Doppler study. If you are able to see that the image in the middle is showing a cortical cyst in the midpole and there is raised echotexture in the kidney. And these are all the kidneys which are showing raised echotexture with loss of CMD, that is mild, moderate to severe chronic kidney disease. And here is a 40-year-old male patient who came with complaints of hematuria and flank pain. On ultrasound, we are able to see a highly echogenic, well-defined lesion, and it is round or oval in shape, which is seen in the midpole of the right kidney, and it is causing mild hydronephrosis. And if you're seeing the CT scan of that patient, we are able to see that there are multiple fat densities which are present in the bilateral kidneys. So this is mostly a case of angiomyolipoma. On Doppler study, there will be no vascularity seen. Now, coming to some of the renal collections and abscesses, most of the patients with renal connections and abscesses present with fever with chills and decreased urine output, dysuria, and pus which is coming out from the urine, pyuria. So, here is a case of a 48-year-old female patient who came to our department with complaints of fever, flank pain, and dysuria with increased frequency of micturition. On ultrasound, we were able to see that the renal pelvis shows thickened and hyperechoic renal pelvis. There is loss of corticomedullary differentiation with hydronephrosis, and there is multiple fluid levels which are seen within the renal pelvis. And if there is any rupture of the pelvic calyceal system, the collection might go into the perinephric space, leading to the perinephric fluid collections. This is a case of a pyonephrosis which was diagnosed in CT. And this is a case of a 77-year-old patient who presented with fever, increased frequency of micturition, and shock. On initial ultrasound scan, we were able to find that there is a loss of renal echotexture completely, raised echotexture with loss of corticomedullary differentiation, and we were able to see multiple echogenic foci which were present in the kidney. So these were showing ring down artifacts. So mostly these are air foci. And On screening the patient with CT, we were able to find that there were peripherally air pockets which are present around the right kidney, and the right kidney is enlarged. Also, there is trickling down of the collection from the kidney along the psoas major muscle, and the left kidney also showed a renal pelvic calculi. So this was diagnosed as emphysematous pyelonephritis because there's gas forming bacteria in the kidneys, most probably E. coli, which was noticed on a microbiological examination. Next, the same patient who had an emphysematous pyelonephritis further had shrunken kidneys, and then on follow-up scan we were able to see that all the collection has collected around the kidneys, and there were a lot of echogenic septae, and air fluid levels were seen, and gas formation was noted. The surrounding hyperechoic fat stranding is seen, which is irregular, and it was noted that it leads to the compression and displacement of the right kidney. Color Doppler flow was performed, and it showed that there is an absence of flow within the abscess cavity on Doppler imaging. However, there is increased vascularity or hyperemia in the surrounding inflamed tissue. Next is a case of a 55-year-old female patient who presented with fever, decreased urine output. On investigations, the creatinine was raised. Ultrasound shows the raised enlarged kidney with echogenic cortex, and hypoechoic or mixed echogenic areas were noted in the dilated pelvic calyceal system with a staghorn calculus. On CT, it showed that there was a renal pelvic calculus with upstream dilatation of the pelvic calyceal system, and the dilated pelvic calyceal system appeared like that of the paw of the bear, showing the bear paw sign. This is most classical of xanthogranulomatous pyelonephritis. Now, whatever cases we have seen, we will be analyzing and interpreting the results. So we have seen that in horseshoe kidney, 5 cases which have come, they were diagnosed on ultrasound and as well as on CT. That is, the sensitivity and specificity has been 100%. So if we have seen that for conditions like horseshoe kidney, chronic kidney disease, medullary sponge disease, and perinephric abscesses, the sensitivity on ultrasound is way higher. However, the conditions like horseshoe kidney, chronic kidney disease, medullary sponge disease, and perinephric abscess can be also very specifically diagnosed on CT scan with a higher positive predictive value. So here we have put that summed up all the renal pathologies, and note down that on ultrasound we are able to diagnose almost up till 70% of the pathologies like the renal calculi, acute kidney injury, and chronic kidney injury on ultrasound basis. The remaining 30%, that is the pyonephrosis being the major, can be diagnosed on ultrasound but more specific on CT scan. And the less, which are encompassing less than 20%, are the horseshoe kidney, pyelonephritis, perinephric abscess, medullary sponge kidneys, and angiomyolipomas are also diagnosed on ultrasound but more specifically on the CT scan. So the horseshoe kidney suggests that both the modalities are equally effective. However, angiolipoma and pyelonephritis, CT is more specific. Renal calculus indicates that the ultrasound is slightly more sensitive but may produce false positives compared to CT, and CT is highly specific in confirming the diagnosis. Acute kidney injury, ultrasound is more diagnostic, and for chronic kidney injury, ultrasound is more diagnostic than CT, but CT is highly specific. Angiomyolipoma, CT is more specific, but on ultrasound, most of the times it may be missed. And perinephric abscess, both are reliable diagnostic tools for this condition. Pyelonephritis, the CT offers higher specificity and a marginally lower false positive rates. So, the final interpretation is that all the renal calculus, acute kidney injury, and chronic kidney injury are more accurately diagnosed on ultrasound. The CT is more sensitive in diagnosing angiomyolipomas and pyelonephritis, and also well differentiated between xanthogranulomatous pyelonephritis or bacterial pyelonephritis, and which is forming perinephric abscess. However, ultrasound stands out to be the primary imaging modality for evaluating benign renal pathologies because of its safety, availability, diagnostic precision, and also no radiation and easy availability. And most of the patients who are asymptomatic need a follow-up And renal calculus are managed by NSAIDs. And renal angiomyolipoma, we give a follow-up for every 6 months. And perinephric abscess, we put a pigtail in very severe cases. Same with pyonephrosis, where we go for percutaneous nephrostomy. So ultimately, we have seen that our ultrasound is able to diagnose 70% of the benign renal pathologies. So ultrasound is a cornerstone in the diagnostic armamentarium for renal pathologies, and it stands out to be the primary imaging modality for evaluating benign renal pathologies because of its safety, availability, and diagnostic precision. However, its availability to provide the detailed information on renal anatomy, vascularity, and lesion characterization makes it an indispensable tool. And with the recent advances like that, with the Doppler study, we are able to make the exact diagnosis, which is close, very sensitive for diagnosing renal artery stenosis and thrombosis. And these are some of the references. Thank you.